Average Americans are struggling with modern health care. It's hard to be a patient these days. What's it like to be a patient? What challenges do they face? I want you to meet some people. They'll show us just how complex and overwhelming health care can be.
Well, I'm a kidney transplant. I've had the transplant for about 15.5 years, but I've been sick forever. Okay, well, I take baby aspirin, that's something new, cyclosporin, prednisone.
And when I make the doctor's appointments, I have to be sure that it doesn't interfere with his doctor's appointments, my doctor's appointments, or their doctor's appointment.
So you don't like to go to the hospital where they give you a lot of papers to fill out?
Paperwork to fill out.
Paperwork?
Yes.
Why is that?
Because I can't read that good.
Because you can't read that well. What does it feel like when somebody hands you a lot of paperwork and you can't read?
I feel like you're in another country.
Vitamin D, Nexium, Norvasc, Colestid, Estratest.
When you enter a doctor's office, the first thing, and your first-time patient there, they're going to give you a clipboard. Sometimes that is very discouraging for a patient who cannot read.
Lipitor, Paxil, Darvocet, Vitamin E.
If I'm really embarrassed or confused or worried about things around me, or worried about my child being all upset, I would not be able to read things I normally would read every day.
You know, some of the words that the angiogram, plasty, and all of that, what is that, several things or one thing, or it's just a language that I'm not familiar with.
If the patient was transferred to that facility and to any and all insurance companies or other third parties paying or obligated to pay, this is not making any sense.
Tums, Tegretol, Tenormin, sodium bicarb, Cardera.
Do you have any idea what a normal blood pressure is?
No.
Any idea?
No. It's normal?
No, it's not normal. It's high. Have you or anyone ever had to sign a consent form?
Yes. I have hereby, I don't know.
Okay. Authorized.
Authorized.
Mycalcin spray, Nystatin, Aricept, Lasix, Ambien, Imodium when you need it, and vitamin D. I believe that's it.
See, you know these people, and even though they represent all education and reading levels, they have one thing in common: low health literacy. It's so easy to make harmful and costly medical mistakes. Just listen to what they have to teach us.
So what you do, you come out of that room, that examination room, with this intelligent woman or man, thinking, God, I hope I don't make a mistake with my medicine, because I did not understand anything he or she said to me.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
So you give her a tablespoon and a half. Can you find where it tells you how many you take? The dosage?
Three a day?
Take 3 to 2 milliliters. And there's something I want to point out. I don't actually read this because I know what it says now. So if I had to sound it out, if it wasn't for I knew it, because I've heard it so many times, I would not be able to read that.
Okay.
Every 3 to 4 hours as needed for pain.
Okay. What's a milliliter?
I don't know.
The medication that was given to her was not explained. Well, we didn't use it.
In fact, she ran out of her high blood pressure medicine, so she didn't take it. She didn't call me to tell me to fill it. So finally I found out that she had not been taking it. I said, Mother, you can't do that. You have to keep taking that high blood pressure medicine.
And then it says discontinue.
Yes.
What does that mean?
I don't know.
How many times do you take these thyroid pills?
Once a day.
Okay. Do you take one of each of these?
Mm-hmm.
Okay, so you take 2 thyroid pills.
No, I take one. I'm more likely got them messed up when I got
refilled.
And then, are these stickers helpful?
Nope, don't even look at them.
Don't even look at them.
Okay. And what do you take that medicine for?
I don't know what it's for.
Okay.
He just puts me on stuff and he tells me when I have it. I just take it.
Low health literacy is catastrophic to patients, their families, and to our healthcare system. Millions of Americans struggle needlessly. Their misunderstanding leads to medical mistakes. These mistakes lead to hospitalizations that we could avoid. Simplifying material alone will not solve the problem. Funding is needed for health literacy research and demonstration projects to identify what works. This problem is costing America a lot of money, but it is a problem we can do something about. As we address healthcare quality and cost, we cannot overlook low health literacy. We must do something now.